It's great to be here. My name is Corinne Stroum, and I am Director of Consumer Experience and Insights from Scan Health Plan.
My name is Anna Peckinpah. I have the privilege of working with Corinne Stroum, and yeah, we're excited to talk today about how we've used natural language processing to serve our members in our healthcare plan.
So for those who are not familiar with Scan Health Plan, we serve just under 300,000 members. We originated in Southern California and have expanded now into Texas, Arizona, New Mexico, and Nevada. Scan has a 50-year history, having been founded by senior activists to care for seniors. We were one of the first social HMOs and have the privilege of being honored for our customer service. So let's talk about how natural language processing can help customer service experiences through healthcare. This is a day in the life of one of our member services agents. We currently serve about 1 million calls inbound annually. This feels like a lot, and it is, because our members really respect the communication that happens verbally. Although we have a growing secure messaging channel and we use SMS and email to interface with our members, they still will pick up the phone to call us. And oftentimes this is because their experiences are time sensitive. They may be standing outside waiting for a ride to take them to an appointment, and that ride is late, or they're running late to pick up that ride. Perhaps they're having trouble getting dentures that fit just right. Or perhaps they've moved and need help picking out a new primary care physician. Every call is a little bit different, and those calls can be handled as individual transactions. But on the consumer experience team where Anna and I serve, we try and take a different approach. We are looking for strategic improvements that we can make to the plan by trying to glean insights out of those individual calls and looking for emergent patterns. We are not an operational analytics team. We are instead very policy and product oriented. The example that I typically give is this. After a call transaction completes, the agent will take some notes on what happened, and they will tag that call with an individual category or subcategory in the note-taking tool. Now, the agent will then say, in this example, the member said that the doctor made the member wait and that the member would like to change physicians. So we just get change PCP. That's the theme. And then if we were to run that through a natural language pipeline, we do the usual, which we'll get into momentarily from a technical perspective. We break out individual words, we look for sentiment, we can find multiple topics attached to that transaction. And we realize that instead of just counting this as a PCP change, we also count this as an access to care issue due to the long wait that this member is experiencing. And we can identify that this had a negative experience implication for that member. I'll pass the baton over to Anna here to explain how and why we built our NLP pipeline.
Thank you, Corinne. And yeah, to kind of quickly reiterate, the idea that we wanted to take all of these notes that our member services team was documenting. Obviously, the process of manually reviewing is just not feasible, especially when we have at scale so many thousands of calls coming in every single day. Especially during COVID, we saw an influx of new issues that had never been categorized before in our current system. Basically, we would previously have templates to address certain common issues that members would be repeatedly calling in about. But with COVID, we had just brand new, unforeseen circumstances, unprecedented issues that we didn't know how to create documentation for. So how are we going to pick up these issues and address them in real time? So the idea was, let's use NLP techniques such as cosine similarity, which is a way to say, if a member has called in about a particular issue, maybe sheltering in place at home, and they're worried about any exposure issues, if that particular call gets flagged by one of our member services team and they want to say how many other calls resemble this call, we can use a technique like cosine similarity to pull all of those in. So the idea was, anything that is being flagged as an issue that is exacerbating members' access to healthcare within our plan that is being driven by the COVID-19 pandemic, we want to be able to address that in real time. So if we transition to the next slide, the visualization on the right is basically a T-SNE plot of the array of LDA topic coefficients. Essentially what it's doing is showing how all of these topics map in feature space. And so what we would do is we create this visualization. We'd have our member service advocates, SMEs, who would basically be the people that knew how to triage and say, there's a particular issue that needs to be escalated to CRTT, or maybe this is an issue that can be handled as an out of area one if a member is sheltering in place. Basically, the people that were in charge of figuring out how to triage and quickly resolve any issues, again, that were COVID-19 related for our members. So in this case, we used the natural language processing technique of LDA to basically say, okay, we've pulled in, using cosine similarity, all of these topics, or all of these comments, I should say, that are revolving around members reporting to member services about COVID-19 issues. Let's use LDA, latent Dirichlet allocation, to basically create clusterings of these topics, and then go in and say, okay, based off of all of these clusterings, what are the common themes? What are the issues that our members are surfacing to us? How do we address them in real time? And so again, huge thanks to the member services team. A lot of this was human in the loop, even though we were doing automation to process thousands and thousands of calls. We did require having those member service advocates to be able to help us in real time to review the calls and really get to the gist of what was needing to be addressed. So this is an overview of the actual Tableau dashboard that we eventually created from these issues that were being tracked week over week. As you can see, these were the ones that, like, for a quick spotlight view, the particular topics that were being tracked in highest volume that particular snapshot in time. This again just allowed us to not only help our member services figure out how to triage on the fly, but also to allow the organization as a whole have the transparency and be able to see everything that was going on, anything that might be impacting our network services, etc. So we can go to the next slide. This is the list of case studies that we wanted to highlight that we think directly impacted a lot of our performance as a healthcare plan, but particularly how we felt like it impacted our membership. So as far as coverage and copays, a lot of the issues around, like, I don't know, as far as under COVID, what I'm covered for when it comes to, am I still on the hook for this if I can't go see a doctor appointment because I'm sheltering in place? What am I going to do about copay for particular vaccinations related to the COVID-19 vaccine that came out? And then also with COVID-19 testing, where were locations and sites that were readily available for members? Could they have in-home nurses come to them instead and administer the test? All of these are questions that were very specific to our members that we wanted to address in real time. And then obviously access to care issues. We had already mentioned out of area. These are basically members that, again, maybe they happen to be on vacation or just simply were not in network to be able to see someone locally at the time where they were sheltering in place. And so we had to figure out workarounds to navigate those issues. Skilled nursing facilities also were something that was brought up as a myriad of issues that stemmed from COVID-19, just because a lot of times these were some of the most at-risk members due to having comorbidity factors due to heart disease or any other issues that could put them at higher risk of COVID. And then again, just our network providers being able to address any of those issues in real time, including any telehealth services that they could provide in lieu of having to go see a doctor in person. So this is just a quick overview of the architecture initially when we created the COVID-19 pipeline. A lot of this is kind of bread and butter for a lot of people that are familiar with natural language processing. I'm sure none of these particular features or techniques are new to anyone at John Snow Labs, but just to kind of quickly walk through it, we had obviously stop word removal, lemmatization, TF-IDF, tokenization, part of speech tagging, and lemmatization. This is kind of like the initial, like, let's clean up the data. And because a lot of our member services notes do sometimes include boilerplate or templatized parts of the text, we wanted to make sure those are taken out so we can get to the real nitty gritty details of what the actual comment is discussing. And then the next part, when we actually get into the feature engineering aspect, we start to actually think about embedding techniques. And sometimes we also would just simply use regex detection, which is, hey, what are common phrases that members are bringing up related to the COVID-19 issues? Zipf's law would look at any niche particular sets of vocabulary that were popping up that were not part of the Zipfian distribution that we typically see in the language and vocabulary that our member services advocates were writing in the notes. Meaning if we saw a niche amount of vocabulary, let's say shelter in place, that's not a typical phrase we had seen previously. The week before, suddenly it became an issue for our members when COVID-19 broke out. That was a way for us to begin tracking any new turns of phrases being brought into the member services notes. And then also obviously topic modeling, as we had discussed earlier. And so to pretty much sum it up, we were able to use both topic modeling and cosine similarity primarily as the techniques to bring in the vast majority of those comments that needed to be processed, and then just using visualization techniques like TSNE to allow our member services advocates to be able to quickly parse through and see how to assess whether the theme of the topic being assigned revolved around a certain set of issues, and then go from there as far as the triage. So going to the next one, I'll hand it off to you, Corinne. Thank you so much.
Thank you. Anna, that was excellent. The team did some pretty incredible work throughout and just following the peak of the pandemic. In 2023, we took a step back. It was no longer as urgent in the moment to address incoming and different needs that were driven by the pandemic. Instead, we were starting to see changes driven by the business itself changing. Our steady state after 2020 was very different from steady state before 2020. As such, we started to think about what techniques we wanted to put into play, some of which, as you mentioned, are still bread and butter when you're doing natural language processing, and we just needed to apply them to the voice of the member or voice of the customer in this case. We rolled out a series of new products. For those who aren't familiar with health plans, look on the back of your insurance card. That's a product. Our products are classic, balance, heart, etc. But we had a number of new products that rolled out. Affirm, our first market LGBTQ product, Inspired, the first product specifically for women. Those were ones we wanted to see what people were calling about, or if they were asking questions about these products when they called. We entered new markets, new states, and new states bring very different problems, as well as new services that we ourselves were offering. So you can see all of a sudden a move away from find me cohesive themes throughout the calls and more, are there specific entities that are being discussed? We also implemented a more rigorous pipeline. What you can see here is the pipeline that we built on Azure Databricks, and you can see that we've moved to one that now has a series of shared capabilities at the start of the workflow and branches into two parallel efforts. One continues that topic differentiation, that LDA and cosine similarity process, and one added on a named entity process as well, because it became increasingly important for us to find specific specialties that were being mentioned. So are our members having trouble reaching gastroenterologists, urologists, podiatrists? Where can we find those specific specialties? And correspondingly, where can we find specific products or services that we ourselves are offering, and what can we learn about them? What we identified is that named entities were very strong in our data. as were the sentiments that we saw as well, which are in the sample here. We can see too that cosine similarity remained in our data set. And now we can start to stitch together something interesting, a story about our members. And as I mentioned, we are not a team that works in isolation on individual calls. We are not operational. We are more strategic. So put on your thinking cap. If you know about what a person is calling about, you know whether they're happy or unhappy, you know what they're calling about in particular, what can you do in bulk? And we have taken our voice of the customer data and we have used it in our predictive models. This is an example of a swarm plot showing the feature importance and strength to the outcome of specific call-derived features. If we build a model to look for what other industries might call churn or attrition, this is our voluntary disenrollment model. During the annual enrollment period or open enrollment period that runs during Medicare Advantage, we are looking for call behaviors or mentions that we believe give us a good indication that a member is dissatisfied and is likely to leave. This checked out. When we did build this model, of the top 10 or so features, 3 are very strongly influenced by call behaviors, and we used this to inform an outbound call campaign. So ahead of annual enrollment, our charter is call members and ensure that their needs are being met, listen to them, and have a frank conversation about their satisfaction. For those members that are targeted as being high risk of voluntary disenrollment, those that we can have a conversation with are more likely to remain with SCAN because we are able to speak to the things that we believe are driving them towards other plans. Additionally, we share this out with teams within SCAN. We work on partnering with our clinical services to ensure that our members' needs are being met. We ideate and support the new product development process with our market team. We work with our network specialists in case there's an issue that is disproportionately impacting one region versus another. We have so many ways that we can bring this data back and put it into use for the benefit of our members. As we look forward, there is still so much yet that we would like to do. In member services, we are rolling out a generative AI support model, and this is very much driven by language modeling and advising someone on what to say based on what we know will have the best impact on our membership. We would also like to apply large language models to help create some of those topics that fall out of the LDA modeling. You'll see in the screenshot here on the right, it's great that we can tease out individual themes. But as Anna mentioned, that was requiring a lot of subject matter expert time to then curate, well, here's what I think this particular topic is meant for. Large language models are uniquely suited to solve that problem. As members aging into Medicare are increasingly technology savvy, today's seniors likely used an iPhone in their later working years. We do also look forward to expanding our channels from pure telephonic and agent notes to chats and emails. But as we continue with some of the voice work that we do, we are looking at the physiological signals of spoken word. This would allow us to use some of the audio from the calls to seek out distress, loneliness, and other cognitive decline, which can be common among our membership. Natural language processing is a fundamental element of how we benefit our members through the call center today. Thank you for joining us.
Thank you.